Assalamu alaikum wa rahmatullahi wa barakatuh. Today we complete our previous lecture, and we want to speak today about the chemical name. And we must know that the chemical name indicates the drug's chemical structure, the biochemistry or the chemistry of the drug. It is a scientific name that precisely describes its atomic and molecular structure, including the placement of atom. And because we speak about structure, so it is very long and very complex. As example, when we want to put a name for paracetamol, we must say an acetyl para aminophenol. This is very long name for paracetamol or paracetamol. You see here in this example, as I said before, chemical name an acetyl para aminophenol, while the generic name is acetaminophen or paracetamol. Generic, as I said before, generic is a non-proprietary name. That's anyone can use it in any country, while the trade name is appropriate. Just the company can put the name and can use it, like Banadol or Tylenol. Here we have the example, the chemical name of propionic acid, ibuprofen, and the trade name Brufen. This is a common name, and everyone know it because it is used by the company which is responsible for production of this medicine. How we classified the drug? Drug classification. Drugs can be classified according to its action on which system. The drug which act on cardiovascular system, or the drug which act on gastrointestinal tract or central nervous system. This is classified as its effect on the body system, as well as we can classify here example antidepressant or anti-hypertensive or anticoagulant or pre-lipidemic. All these are examples for the systemic classification of the drug. Also, we can classify drug according to the mechanism of action, how it acts. That means diuretic act on the volume of the fluid in the body, as to reduce it or increase it. In case of hypertension, we give diuretic to expel or to much water from body to reduce the high pressure. Also, calcium channel blocker. Some drugs block the channel of calcium, and this also can treat hypertension by decreasing cardiac contractility, because calcium is responsible for the cardiac muscle contraction. Here we have a title under drug prototype, and this is a type of classification that single drug, one drug, compare with the other drugs according to its action, and its adverse, not just its action, and its adverse action. Like morphine is the prototype of opioid analgesic, is analgesic. So we can compare any analgesic with morphine. So morphine is a prototype. And also penicillin is a prototype for an antibiotic. Okay, this is drug, we call it prototype. And we have what we call ideal drug. Ideal drug, that the drug which is can act and also it have adverse action, but we can compare it with other drug. according to its effectiveness, the drug is one that elicits the response, which stimulate or inhibit. So according to its effectiveness. Also its safety. The drug is cannot produce any harmful effect. And also according to its selectivity, and this drug elicit only response for which it is given. It acts in one way, just to sedative or to increase or to decrease. Okay, this is, we call it a selective drug. And this drug will not produce adverse effect. Will not produce adverse effect. But as a general, we haven't any selective drug. All drugs are non-selective because most of them elicit response and also it have adverse effect. Reversible action, that means the drug action to subside within a appropriate time. Act within appropriate time. Also predictability. This is a predictability. Predictability. This drug is very simple to be administered. This is type of a drug. And also how it easy to be administered. Also this is properties of the ideal drug that can be taken in a short length time. Also we have what we call it according to freedom of a drug interaction, that it is not interact with other drug, they not interact with other medication as well as with food, and inexpensive and easily accessible. يعني that means especially with the chronic illness or hypertension, that it can not very expensive, we can gain it easy to use. Also some drug lose effectiveness during storage. Some drug lose its effectiveness during storage, so storage is very important, and this is we call it chemical stability. So the ideal drug must be stable, cannot change with any change in the environment and when it is stored. Also position of simple generic name, to have simple generic name, to be easy to be used, to be easy to provided it easy to be recalled or pronounced, easy to say it. This is what we call it possessing a simple generic name. But also we haven't any ideal drug. There is no drug have this property perfectly. So we haven't ideal drug. What are type of drug or category of drugs? We have prescription drug. This is drug used by order of physician. Okay, drug obtained by prescription or by medication order, like this. This is we call it Rochette. This is we call it prescription drug that used by order. And person with a legal authority to write such prescription, usually doctors. This is responsible, or this is especially the doctor can write it and give it, and the pharmacy legally give it to the patient. But these drugs must be administered or given by a nurse. So the responsibility of giving this drug is the nurses, while the doctor is responsible for write the prescription of a drug, as we say, to write a Rochette. What's include this rochet? It includes the full name of the patient, or full information, age, sex, even address or phone of the patient, as well as date and time of orders, and name of the drug. Include the dose, the route, and the frequency of administration and duration of treatment. This is all written by doctors. And finally, we must put his signature, the doctor, and the description to be legally. Non-prescription drug. This is, we call it over-the-counter drug, or what we call OTC, over-the-counter drug. This is a drug without, can the pharmacy give it to you without rochet, without prescription. As I say, it is not required provider order. And this drug designed by the FDA to be safe. Yeah, safely. This is safely. If you take it from the market, if you take it from pharmacy, if anyone give it to you, this is safety to use. This is what we call it out the counter drugs. And this is given according to the symptom. When you have headache, you can take aspirin or paracetamol, or if you have, or you can take purgative if you have constipation, or you can take as example purgative, you know, or maybe you take, if you have a diarrhea, we can take a coating materials to decrease the diarrhea. This is also you can take it without a prescription. So this, we call it out or over the counter drug. Why patients prefer to take OTC drug? Because it is very easy to be obtained, and non-appointment with physician. You don't need to go to the doctor, and you don't need prescription, or you don't need order to receive this drug. So, misconception, they can effectively treat themselves and may believe that OTC medication, that the patient can treat himself with this drug, and haven't side effect in the normal drug, haven't side effect, so it's safety. But OTC product still cause this side effect of drug interaction with food, or if you take it in big quantity, maybe it cause side effect. So self-treatment is sometimes ineffective, and the potential of harm may increase if the disease is allowed to progress. Thank you very much.